I spoke with the president of the Nigerian Medical Association, Professor Innocent Uja, and I began by asking him to assess the state of Nigeria's health system 60 years as an independent nation.
Very much for having me, and good evening and happy independence. Nigeria has come a long way. The assessment is very varied. First, Nigeria at 60 had only one hospital. Today, we had over 70 federal establishments and federal medical centers, federal teaching hospitals, specialist hospitals. These are for federal government, and the various various states also have developed and established their own hospitals. As far as the number, it will appear that Nigeria is doing very well. Now, the number of doctors had increased up to about 40,000 doctors in Nigeria, but these are not enough. So largely, we can say that Nigeria has moved in terms of infrastructural development in the health sector and also capacity development. But the reality is that we have not gone there yet. The health indices have remained poor. Infant mortality is very high. Neonatal deaths is quite high. Maternal mortality is very high. And the referral system is very poor. For instance, many of the roads are not accessible, and therefore in emergency situations, you cannot send out patients on time to assess emergencies. So by and large, it is seen that I think it's work in progress. Nigeria would have achieved more, but we believe that at the moment, we need to do more.
Professor, in spite of the apparent weakness in the health sector, there has been some consistent improvements, if you like, in some indices. Take, for instance, the case of Ebola that was handled relatively quickly. 2, we're now certified polio-free. And thirdly, there has been some proper handling, as it were, success in tackling of the COVID-19 pandemic. What is fueling these successes?
Well, it is true. We are glad and we are happy that we are now polio-free, not after a lot of obstacles and setbacks. But on the final note, we are now polio-free. However, we did very well with Ebola virus in 2014. We also tried to do better, probably in 2020 for the COVID-19 response. But I must say that the COVID national response should have been better handled. The national coordination is not as good as we would have expected. And it's also true that COVID-19 has exposed the nakedness and the weakness of the health system in Nigeria. Therefore, we use the lessons of COVID-19 to improve our health infrastructure and facilities. And I had always said this, and I'm sure others would agree with me, that we need to have a health bank. A health bank, just like Bank of Industry, just like Bank of Agriculture, so that we can build the state-of-art facilities and then curb medical tourism. Those who go to India go to private hospitals, they don't go to government hospitals. And we believe that if we have a health bank, then we have a low interest rate so that people can build, there will be a consortium of health professionals and others so that they can put up-to-date equipment, hospitals with up-to-date facilities. That will help our people. And I think that that's the way to go. The private sector development in the health sector is not the best. We also know that the National Health Insurance Scheme is not doing very well, and we believe that every Nigerian adult should pay for health and therefore should be enrolled in the National Health Insurance Scheme so that we have sufficient funds to be able to deal with health situations in Nigeria. Health is very expensive. And if we depend on government alone, we will never get there. So private sector participation is very important. And I think that we should have a bank for health in Nigeria.